All right, guys, this is Dr. Brian Opp from Opp Family Chiropractic right here in St. Francis. And today I'm going to go through how we do AK in our office. So specifically when we're looking at the pelvis and the backside, the sacrum area here. So where a lot of people get pain in their low back, there's two very large joints. So the dimples on the backside, just usually right below the belt line that most people have. What that affects then is typically you can get some sciatic-like pain down the leg. You can get weakness in the leg, pain with getting in and out of chairs. Those are all things that people have when they have this issue going on. So we want to differentiate between is it pain coming from like a disc or your low back area, or is it coming more from like where the tailbone is in that area where those joints are. So a simple thing that we do, the strongest muscles in your body pound for pound are your glute max specifically, so those muscles in your butt cheek, right? So we want to test those. So first we have the patient keep their knee straight and push their leg out to on this left side to the left, and then see if they can hold it. I shouldn't be able to push that leg over at all. And so clearly there's an issue here. So then we just do the same thing to the right side, keep that knee straight, push out to the right, and that's pretty strong. So we know that we have an issue here. So how do we evaluate that? We can just do a simple little test, give a little bit of what we call a thrust into the joint, or a fake adjustment essentially, and then we test again. So push right, and that's much stronger. So what we would do here is how we would adjust that. We put some blocks underneath the hip, and we'll grab these blocks over here, and then we can see if that helps strengthen that area. So this should make the problem when we put the pelvis in the correct alignment and the sacrum in the correct alignment. This should make it substantially stronger. Kick out to the right. Good. And you can see often when I'm watching too, is that you see the roundedness, the muscle actually doing its job to be able to hold that joint together. If that's weak or it doesn't strengthen, then we look farther into other things. One of the other areas that we'll look at, there's a small muscle in the middle called your piriformis, and that will create a whole bunch of different issues as well too. That can also give you the sciatic pain there because the sciatic nerve has to run around it, through it. There's like 6 to 8 different ways that the sciatic nerve can be pinched and impeded on and give you those symptoms down the leg. So the adjustment is simple. I like to use a drop table in our office, but having this, so we hold the joint together and we can just do a nice, easy pumping motion here through that other side to align the area there. So in this instance, we often then have to put on a sacral belt. So what that does is it helps with the ligaments there in that area to be able to heal up so that we don't have those issues keep coming back over and over again. So we test, kick your leg out to the right, the left, good. So yes, so that's strong, but let's see if he'll hold, right? So this is him. I often say to my patients, this is him walking out the door, or the patient walking out the door. See if it holds, push to the left. Good, and it looks like it's going to hold. To protect it, we use, like I said, this sacral belt. We really like this. There's a brand called Sorolla that we use in our office that we really like. So essentially how it's worn is we lift up, let down. So it's just below your normal belt line. So then that helps hold that joint together, essentially squeezing that joint. It's very wearable during the day. Often we prescribe it for 7 to 10 days. You wear it all day, every day, at night, because when people roll over in bed, they disrupt the joint. They sleep in weird positions, so the joint isn't being held together very well. And then we just do kick out to the left again. Good. It's strong, and you can see that the muscle's contracting the way it is. So that's how we evaluate if the problem is coming from the pelvis, because this is your foundation. And if this isn't solid, then your low back is going to be tight. So we always check here first before we move up into that lumbar spine. So guys, if you're dealing with some low back pain, we deal with it every day. We go through these checks on everybody. All the doctors in the office do the same things so that we might be able to get to the real root of the cause of the problem. Often too, if you squeeze your butt cheeks there and your low back pain gets less, that's usually a clear indication that something isn't functioning. So if we chase the pain, we often are getting lost into the woods, right? So getting to the root cause is what we do here in our office. So if you guys think you guys might have this, definitely give our office a call, reach out to us, and we can definitely be a help. Thanks, guys.